Hi, I'm Doctor Melike and welcome to our panel. Now that you have successfully made your first step towards your journey, here's all the things that you need to be careful before your surgery. First of all, make sure that you shared all of the details of your medical history accurately with our team by filling out the medical review form that will be sent to you by your sales coordinator. The things we need to know is your underlying conditions such as diabetes, hypertension, any psychological condition, heart conditions, etc., your past hospital stays and surgeries, any allergies, any history of thromboemboli, and your family's medical history. For people who can get pregnant, it is recommended to get a pregnancy test before your arrival to avoid any last-minute cancellations. And for people with anemia, it is recommended to get a complete blood count test to make sure that your hemoglobin and iron levels are optimal and it's safe for surgery. Other than that, before surgery, some medications need to be stopped or altered before the surgery, depending on the reason that they are being used. So make sure at least 2 weeks before your surgery that you discuss it with your prescribing physicians. These include blood thinners such as aspirin, warfarin, or Eliquis, and a group of drugs that we call non-steroid anti-inflammatory drugs. And the most common one is ibuprofen. You may know it as Tylenol. These needs to be stopped at least 1 week before surgery, but as I said, make sure you discuss it with your prescribing physician. Other than that, if you're using any hormonal birth control, especially with estrogen in it, it is recommended that you stop using it a month before your surgery. Also, any herbal medication or supplements needs to be stopped at least 2 weeks before your surgery. You should stop smoking at least 4 weeks before your surgery because smoking decreases the blood flow to the tissue by narrowing the blood vessels and delays the healing. It also increases the risk of pulmonary complications during and after your operation. So for the sake of your own health, of course, it is recommended that you do not start smoking again once you stop it. Also, you should stop using alcohol a month before your surgery because alcohol increases the chances of bleeding during and after your operation. For your hospital bag, here's what you need to pack. You should have comfortable clothing, a safe non-slip footwear, toothbrush, comb, other toiletries that you may need, a small amount of cash, the current medication that you're using, and if you have sleep apnea, please bring any machine that you're using for it. All the piercings, jewelry, nail polish, and acrylic nails needs to be removed before the surgery because they may interfere with the operation. If they need to be taken up by a professional, make sure you arrange it before your arrival. For any further questions, you can read our pre-op guidelines, and of course, you can share any questions or concerns with our team anytime. Thank you for watching.